As we know, one of the priority messages for asthma control is trigger reduction. I think clinicians do a really good job of prescribing medications and listening to lungs. I think many of us do a bad job on trigger reduction. We don't want to talk about, cockroaches and mold and scrubbing your bathroom because, we want to talk about medicine. And it's been a struggle, and I think we're getting better with that. Not all the electronic health records even have triggers in the electronic health record to trigger the provider to check off that they talked about trigger reduction. So again, that's something that the home visitor can do, and we're trying to push that a little bit more on the clinicians. And lastly, because I got my time's up sign, is, as I mentioned, these planned follow-up visits. So you get the asthmatics to come in before they're really sick with acute exacerbations, but for maintenance visits. And so that's all part of the patient-centered medical home. So I talked way too fast, but that was a quick summary of about an hour and a half training we do with healthcare providers that we would love to come to wherever you are to do.
If you read this information that we get, we got this information in 2005 when we started the program. We have some information from CDC, from pediatrics, and if you see the asthma prevalence, ED visits, and the Hispanics, when they receive, what kind of the treatment receive, if they receive appropriate medication. This was in 2005. In 2011, do you think this changed? Probably not. Probably it's the same. In 2005, we conducted an assessment. What happened with asthma in Montgomery County? At this time, we conduct a focus group with parents of children with asthma and a group of teens. We conduct a deep providers interview and a literature review. We found these results. We have a language and poor communication, lack of comprehension to follow direction, the cultural concept regarding disease and medicines, unwillingness to accept a chronic disease, lack of counseling and asthma education, a cultural competency and socio-economic position. We found a lot of disparities affecting Latino community regarding of asthma. With the results, the conclusion of this study was we have to design an intervention, educational intervention. It will be comprehensive, culturally and linguistically competent, tailored for Latino population, community-based, target to parents of children under 11 years old, and the social support and follow-up. Provide social support and follow-up. This is what the idea to develop this program. The target population of this program is low-income Latino parents who have children under 11 years who has asthma. And the long-term reduced ED visits and hospitalization rates among Latino children who live in Montgomery County. And the side outcome is to empower Latino families to appropriately self-manage their children's asthma. We have this component in this program: community engagement, educational sessions, asthma coaches, social support, follow-up, and advocacy. How to conduct an advocacy effort? We have a community advisory committee, and this committee is composed by experts on Latino health and parents of children with asthma. This group will provide to the program guidance to the program activities and support for asthma advocacy. The community engagement. We have a strong partnership with the school health services, community-based organizations, community clinics, and state and county agencies. The parents are in the advisory community board. We conduct outreach and community activities and support another community programs. And we conduct every year a Latino forum of parents of children with asthma. The reason to community engagement is to building a strong relationship with community members and organizations embedded in the community. The other component is educational session. It's a series of 8 2-hour educational group sessions. They complement and reinforce the asthma care provided for the doctors or the care providers. It's in accordance with the National Asthma Guides. The sessions have both educational and mutual support functions, and we work with a small group, no more than 15 parents in each group. And the curriculum, we develop a curriculum based on adult learning and popular education. The educational session is not a lecture, it's a workshop, because the parents participate with their own experience, and we build the knowledge session, and every session we build the knowledge and we change the behavior in the parents. The asthma coaches, as known as consejeros, is a combination of 2 words, consejera and educadora in Spanish, counselor and educator, because this word is very common in Central and South America, the people who work in the community. They are volunteer foreign trained nurses, come from the community, and receive training based on a curriculum developed for the program. The training is on the asthma basis and social support. And this is a group of the consejeros. The other component is social support. The social support is provided by the trained consejeros, and they address questions and concerns identified by years, identify issues faced by the families, and help to identify solutions and encourage mutual cooperation. This group of ladies is a volunteer, but they have a very good approach with the community. They talk very close with the mothers. They are very involved with the program with the kids, and they are very helpful for the program. And the other component is follow-up to participants provided between educational sessions, weekly by phone calls, and after 6 or 9 months, when we completed all the asthma session, we have another follow-up session and ask with the parent what happened 6 or 9 months after they complete the program. How does the asthma program works? We have a partnership with the whole school health system, a school-based program, community-based organization, and community clinics. The school nurses basically identify the patient or the children who has asthma, and the list of these children provide to the school-based program. And the staff for this school-based program asks to the parents for their permission to release this information to us. If the parent accepts to release this information, we start to call into the parents and invite them to participate in the program. We provide a detailed information about the program. We explain about the benefits, including participation, and the school-based program provides the facilities to conduct the sessions. In other words, the program ran in every school in Montgomery County. So far, we have 24 schools under this program. The asthma program provides and implements the program, the outreach community activities, and develop partnership and report the outcomes. So the parents receive asthma education, material and supplies, social support, and follow-up. We started in 2006 until 2010. We had 215 participants that completed all 8 sessions. There were 185 women and 30 men. They participated 97 Latino parents and 21 caregivers. There's a grandmas, uncles, and a child care providers. In the program participated 213 children in the ages 1 to 12. One is something to say, this 3 to 12. There were 127 boys and 86 girls. And this is the picture of the first group that we started 6 years ago. What is the results of this program, of this intervention? You can see in the light color, and I think it's green color, we have the result in the pre-test. In the dark color, we have the results of the post-test. The parents improved in asthma knowledge, the self-efficacy. They improved to having a plan and using the plan. When we start the session during the pre-test, we ask the parent who raise the hands who has an asthma action plan. A lot of parents raise the hands. When we ask, show me your plan, they provide the prescription, the insert, everything. When we check for the second time, only 23% has a real asthma action plan. But at the end of the session, 91% of the parents has an asthma action plan for the children. And the most important thing, they learn how to use the plan. Good. One thing is have a plan, the other thing is how to use the plan. Regarding the reduction in morbidity, we reduced the school absences from 45% to 29%. The restricted activity was reduced from 41 to 26, and the visit to emergency departments was reduced to 27 to 15%, and the hospitalization rate, hospitalization during this period, we reduced from 8 to 1%. What happened after 6 or 9 months? After the 6 or 9 months, we lost almost the half of the parents because they moved another neighbor, another county, the telephone was disconnected, different reason. But when this group, when 107 parents, we have this result. The asthma knowledge is almost the same that in the post-test when they completed the sessions. The cell efficacy is almost the same. They having a plan. A lot of parents have, more parents have an asthma action plan. They are using the plan. The school absences, restricted activity, and ED visit go down. During these 5 years, we have lessons learned. One of these is asthma program as a model to modify parents' behavior. The asthma program is useful to remove learning barriers. The language is the first thing. Cultural competence, language, ability, ethnicity, and background of the health educator and counselor were significantly helpful in the intervention. Social support encourages parents to establish a friendly network. An idea of this group of parents is organize clubs of parents of children with asthma. We are working on this idea. A comprehensive medical care. The parent experience and demonstrations help understand prescription and encourage parents to follow up the healthcare provider directions. We don't only provide how to use an inhaler. You have to practice. They learn how to use a peak flow meter, but during the session they make practice how they use this peak flow meter, how to use the inhaler, or how to use the everything. The school absenteeism and visit to ED is a common challenge facing children with asthma, and visit to ED due to asthma can be reduced with this kind of program. The home environment, this is a big issue. Education is not enough. Improving the home environment to remove asthma triggers is difficult for many parents because they don't have their own home. They rent the home, and the landlord, and the building, and the apartment, they don't want to improve the home. And the recruitment and the training is being to be flexible is very important for Latino community because they have a lot of fears. They don't want to participate in educationalization because they have fear that the immigration rates, for example. Require committed partners to motivate parents, like linkages to learning. The school health system in Montgomery County, they help to us to encourage the parents to participate in this program. And this is the last group that we worked. The first picture, there was the first group. It is the last group in 2010. And thank you for listening to my perfect English.